Let's talk to Andrew Bridgen, Conservative MP for North West Leicestershire, because there is a vote on Wednesday, which is due to take place in the House of Commons, in which the lockdown and its various different measures will be voted upon. There will be several rebellions from the Tory backbenches. The Labour Party under Sir Keir Starmer are expected to vote with the government. Let's find out from Andrew what he's going to do. Andrew, very good morning to you.
Morning, Mike.
Thanks very much indeed for joining us. First of all, you in Leicestershire there have had a pretty good run at this lockdown business. How are things there, and what is the kind of current status of Leicester's infection rates?
Well, I don't border Leicester, thank goodness. My constituency is North West Leicestershire. 8 weeks ago, we were below 10 cases per 100,000, one of the lowest in the country. The latest figures I've seen, and I've been monitoring the figures every week for my constituency, is 176 cases per 100,000. And I've got about 80,000 electors and 20,000 children, so we are more or less 100,000 people. But what's clear from the figures is that those infections are not spread evenly across the demographic. The latest figures I've seen for the more vulnerable group, the over 60s, would be around about 60 cases per 100,000.
Okay.
However, the 17 to 21-year-olds, around about 650 per 100,000, wow. So 11 times more. These people are the least likely, we know, have historically been the least likely to go along with the social distancing and lockdown rules. They're also the least likely to have severe repercussions from the virus or require hospitalisation. I think the problem is that that's now starting to spread into the wider population.
Yes, interestingly enough, before I was about to speak to you, I was looking on Twitter, and Maria Coalfield, one of your colleagues, who's the Tory MP for Lewes, has tweeted out a picture of some students at Sussex University having a Halloween party last night, and she's basically saying this is why we are having a national lockdown, large COVID numbers around university and large-scale parties on campus. I expect Sussex Uni to take action. To which I would say, well, fine, why don't you lock down the students then? Instead of saying to them, basically, you're outside of the lockdown, you don't have to worry, you can still continue to do what you like.
Yes, but they won't be able to go to pubs and socialise, will they? There will be effectively...
Well, they're not in a pub last night. They're basically having a Halloween party in the street.
Well, I've seen lots of local news here in the Midlands. My old university, Nottingham University, is only just up the road, and lots of students out and young people out enjoying themselves in Slab Square, as if it was the 4th of July party in America, quite honestly. What these young people need to realise, yes, I remember what it was like when you're 18 or 20 and you're immortal, and they are very unlikely to have any severe repercussions or results from the infection. But what they do need to realise is going into a second lockdown is going to devastate our economy. It's going to put up the national debt. It's going to reduce employment opportunities for everybody, and especially young people, which they'll be looking for jobs when they get out of college in a few years' time. And also, they're the demographic that's going to be paying the taxes to service that debt for a very long time. So they are completely committed with us. We're doing this for them as much as anyone else. Yeah. And we need a bit more discipline. On the whole, in my constituency, throughout this lockdown, I've been so proud of the way my constituents have, the discipline they've shown in the shops and the pubs and the restaurants. It's been very very heartwarming the way the sacrifices they've made, and now we're going to go back into another lockdown on Thursday.
Well, that's what I think is so frustrating.
I've got an airport in my constituency with 8,500 jobs. It's the major employment hub. They have been devastated over the last 10 months, and there's no respite for them, quite honestly.
No, there really isn't. And I think that's what's frustrating to a lot of people, because most of us are fairly compliant and have been compliant. I'll wear a mask if I'm asked to wear a mask because I have to go into a shop. I'll wear a mask if I go and pay for my petrol. I'll wear a mask when I come into the office here because you need to wear one in the lobby of the building. All of that stuff people are willing to do. But I think when they see that they've done all that, they've gone to the pub, they've sat distantly from people, they haven't broken any rules, and yet they're seemingly being punished because of the people who are breaking the rules.
Yes, but at the end of the day, what I do know, and I want to burst this bubble immediately. If anyone out there is thinking that a Conservative government led by Boris Johnson wants to bring these measures in without genuine reason, you're living in dreamland. Boris was in my constituency the last week of August to promote returning to school because by one quirk or another, Leicestershire schools, we actually return to school after the summer holidays before the August bank holiday. And Boris was here, and I've spoken to him at length about this. The last thing Boris wanted to do was to bring in another lockdown. Boris does not want to be the Prime Minister that shuts pubs, clubs, nightclubs, restaurants, theatres, cinemas. That is not how he wants to be, and he knows the effect it will have on the economy. And for those who are saying now, let's just shield the vulnerable. Let's look at the figures. You've got 12 million people probably over 65. You've got another 10 million people who are in the vulnerable category with underlying health condition. That's a third of the population. And the report I saw 4 weeks ago, which I read in depth, showed that if we went for a shielding option, you were looking at potentially 180,000 more deaths as a result of that. And let's look at the decisions that our close neighbours and economic competitors in France and Germany have come to. They've come to a conclusion that they're going to have to lock down. They've already locked down. There's no way that Boris would be proposing this unless he genuinely believed that this is the only option, because it is effectively a political U-turn. He said there was going to be no further lockdown, but the answer is, if we're going to end up in a situation where the NHS is going to get so overloaded, it won't just be COVID patients who will be suffering, it will be people with heart attacks.
Yeah, but people are already suffering, Andrew, as you well know. There are lots of people who are not getting treated, and people. The trouble is, Andrew, that people are fed up of listening to figures which are projection figures, which are not based on anything other than a mathematical model, right? And there is no evidence to suggest that the NHS is going to be overwhelmed. And by any means, we've got these hospitals which were Nightingale hospitals set up, which weren't even used the last time around. I'm happy that they weren't used, and we should all be happy that they weren't used. But there's a massive amount of capacity there, which we are nowhere near using.
There is, but there's a huge. That's a huge call. That's a huge call for anybody to make, and it's very easy if you're not in the position where you have to make that vote on Wednesday to say, well, let's just take a chance.
No, I get that, but it's also a huge call to do. But it's also, Andrew. Yeah, Andrew, it's also a huge call to make without taking into account those people who will suffer, as you've quite rightly pointed out, as a result of a lockdown.
My constituents are. Well, there isn't a no damage solution the government could come to, or any politician in this situation. That unfortunately there's no silver bullet solution where everything's all right. Whatever decision the government makes or the Parliament makes on Wednesday on the vote is going to damage people.
Yes,
that's the situation. It's about minimising that damage, and we can have that debate whether we can try and shield or we go for a full lockdown. That's a debate we're having now. But there's no answer that doesn't damage people. No,
I get that. But equally, you are causing damage. The government will cause damage deliberately, effectively to people while trying to avoid causing damage to other people. So it's a kind of logical fallacy, isn't it?
Well, we have to make a decision. We either carry on as we are, and the fact is that what we've got to do is take the people with us, whatever happens. And I think
I don't think you're doing that.
Well, in that case, no lockdown can work, can it? Because the reason the tier system hasn't worked is because the people have not complied.
Maybe the reason the tier system. There is an alternative, Andrew. There is an alternative, Andrew. It might be that it doesn't work just because lockdowns don't work. It might be that, mightn't it?
Well, the first lockdown works, didn't it? Suppress the virus, and the Labour Party will say, we should have got into a mini lockdown several weeks ago. Well, you've got to remember that we can't just stay in a cycle of lockdown, release, our number goes up.
Right.
The sooner we go into a lockdown, the sooner we come out of a lockdown, and then without a viable vaccine, the R rate goes up again, and we're going into another lockdown. So the longer we can last between lockdowns, and one would hope and pray that if this lockdown comes in on Wednesday, it's the last one we've got to have before we get to a viable vaccine, and we buy as much time as possible.
But the alternative is we try and shield the vulnerable, and
the reports that the government have been given, and I've read, would indicate that that will lead to 180,000 additional deaths. That would overload the NHS. And you can see the pictures on the TV of the nurses and the doctors who've got to triage people with illness and decide they get treatment, they've got a chance of surviving, they're going to die.
Yeah, but that's all speculation.
We can be in.
Well, it could be, but it's all speculation.
And we saw that happen in parts of Spain and northern Italy. We saw that in the first wave. That's what happened. That's what happened.
Yeah, but here's the thing, Andrew.
Yes, but what?
Well,
yes, but what?
Well, but nothing has worked, right? You told me that the first lockdown worked. It effectively worked for a couple of months, but it didn't work because now we're having another one. So it didn't suppress the virus. No, it didn't suppress the virus. The virus is out there. You can't suppress it.
We did suppress it below 1 so that the R rate wasn't going up.
The R rate's a load of old cobblers, though. The R rate doesn't matter a jot, Andrew, because you know as well as I do that the R rate is a collection of data which is put together, which includes things like if you open the schools, the R rate goes up regardless of what happens. So the R rate is not a proper measurement as far as I'm concerned. But let me ask you one final question because we've got to run. Would you be willing to vote for or propose or accept a 20% pay cut for all public sector workers apart from emergency workers in the emergency services? Because that's what some people are asking me to ask you.
I think that's a legitimate... I did listen to your caller before I came on air, and I think it'd be very hard to argue against it.
Well, I should look forward to seeing that being taken forward, not necessarily by you, Andrew. Thank you very much indeed. Andrew Bridgen, Conservative MP for North West Leicestershir. He's concerned that we may well end up in a place where there are nasty and horrible things happening to the populace. But not an awful lot of the people seem to be going along with that. You may be one of the people that disagrees with me, in which case I'd like to hear from you, please.